today we're going to go through how to set up an art line. Okay, so you just crack that open and everything is in drawer 5. What you want to take out is the art line with the vamp. It'll say with the vamp. Okay. Then we get our little 3-way stopcock extension. We grab a blue cap. We grab a 500cc pressure bag that is supposed to be in the drawer. The anesthesiologist may ask for an arrow. This is what you take out to give to the anesthesiologist. It's just the needle that they use to place the line. Okay, so that you can hand to the anesthesiologist while you're preparing your line. And that should be all that you need for right now. So, and you're also going to grab your normal saline 500 cc's. When you open up your tubing, there's a little bag inside that has a little white cap and some stickers. Hang on to this, it's useful. There we go, I got it! Yay! Okay, there's your extension and your cap. I'll open it in just a minute. Now, when you undo your tubing, go ahead and leave this paper on. If this tubing isn't all stretched out, it's going to make life easier for you in the future. And you can just actually put some tape right around here, okay? The first thing that I do is I close down your vamp all the way, push it all the way down, okay? The next thing I do is switch out or put your extension on your tubing, okay? And you're gonna turn this off to the patient side, okay? And then as you go back up your line, you're going to keep going to your tubing here, and you're gonna go off to the patient side here too, okay? You're gonna take off this paper, and now you're ready to spike your bag. As you spike this, you want to burp your bag, but it's okay if you have air in the chamber. What you want to make sure of is that as you're priming your line, you don't have any bubbles in your line. That's really important. So you're going to find your trash can at this point, and you might need a friend to help you hold your line over the trash can. But we'll hang this up. And we can go ahead and open this up, because the way that you flush your line is by pulling on this pigtail right here. Okay, so trash can in front of you. You're gonna go ahead and pull your pigtail up, and you will see that in your chamber, you're flowing freely in your chamber, okay? Once the water or the saline comes through here, you get your little white cap, and you change out your white cap. Okay, and then you close this off to the port. Then you can go through to the next port. The next port is right here. So you're gonna pull your pigtail, and you're gonna go through all of that. You wanna make sure that no air bubbles are remaining in this tubing. So you're gonna watch it. And it's gonna come out like that, okay? As it drips, you're gonna turn your stopcock off to the port. You're gonna grab your blue cap. You're gonna change out this clear cap with the hole in it for the blue cap, okay? Then you're gonna wanna prime through to the end of the line, okay? At this point, if you're sure there are no air bubbles, you can hand this off to the anesthesiologist, okay? But in the meantime, you're gonna go ahead and put your bag in your pressure bag. There's a little hook to hang your fluid on. You're going to close this off to the outside, and you're going to inflate your pressure bag until you see green right here. Muscles. As you can see the bag getting tighter and tighter, you'll start to see this dripping a little bit. That's okay. And almost there. There you go. Okay, you see green. It's really important to turn this stopcock off to your bag. Okay? Now you are 100% set to go. Art line up to your MP50, you can do some of the things that are a little harder to do during an emergency, like take this off and tape it. And I honestly just leave it just as it is and tape it here. That way you don't have a lot of excess tubing kind of getting tangled in everything. If you think about it, you know, this is going to be sitting in the correct spot next to the patient, and so that's all the tubing that you need here, because this is going to be the patient's wrist. So once you have that done, you can make your little pillow for your transducer. I just use a baby blanket. Just move it around like that. And this way you have something to help keep your transducer stable. Before you tape it, you can stick your stickers on. Now, remember that your cable is always up. So the side that goes to the patient is down. So as you're putting your sticker on, you're going to want it to read in that manner. So you're going to have it come this way so that you can read arterial when it's in the correct position. And you're going to go ahead and tape your line to your little pillow. And you can do this prior to getting back into the room too. It just depends on the urgency of the anesthesiologist getting the line and everything like that. In the OR, they have a place to hold the transducer on a little stand, so having the pillow on it isn't really important. If you're in the OR, if you're in the room, you might need to do it right away. You're going to make sure that your connections are all tight as well. And there you go. So this is ready to sit next to the patient. You can stick your little red for arterial sticker on the chamber. Not that you have more than one of these going. Sometimes there's arterial lines, then there's also CDPs too. So now you're going to plug your MP50 in, turn it on. And then this is going to be sitting next to your patient, mid-clavicular, 7th intercostal space, right here as you're doing these things. You're going to get your cable. This fits right in here, just like that. This goes on the very top, just like that. Now, you're going to have your arterial blood pressure reading here, but you're not going to have your heart rate or your respiratory rate. So I like to just go ahead and turn these off. That way you're not going to have extra things beeping at you, extra things on your screen. Okay, so here's your red art line. So when you're ready to zero this out, you're going to turn your stopcock down here on the line off to the patient. You're going to open the port to atmospheric pressure. Okay? Now back on the monitor, you're going to hit the numbers. You're going to scroll, and it says 0 ABP. You're going to hit 0. You hear a beep. Then you're going to see a 0, and then you're going to hear another beep. When you hear that second beep, you know you're ready to go ahead and close your port and open up your stopcock. At which point you will have an actual reading here on your screen. Now, to make sure that you're doing okay, you can do a flush by pulling the pigtail, and you see your square waveform right here with the little, I'll do it again, with the little whip. That means that you have a really good reading.